I'm now in the second nursing home I've ever been admitted to. I was first admitted to Autumn Care in, I was actually admitted on May the 13th, I believe, in 2021. It was an absolute hellhole. My first roommate crapped all over the room constantly and they couldn't keep it under control. They moved me to another room, and that roommate was stage 4 bone cancer. And when he got his duoted, he would go through cycles where he'd be calm and then he'd get mad. This was an ex-biker guy, and he was pretty nasty. And I never got control of the TV because it just couldn't happen. So anyway, I used my phones and whatever to basically learn a lot of things like sushi and about model airplanes, and had a lot of text conversations with friends like Christopher Callow in Australia. And one morning I had a very peaceful feeling come over me, and I happened to look at my phone and there was a message, and it was from Christopher, and it said that he and his wife were praying for me. So anyway, I'm now at Encompass Nursing Home in Fort Mill, South Carolina. It's a new facility. I've been abused by no less than 3 nurses or techs or therapists. I'm writing about that because I'm having to deal with Medicare, because they were going to kick me out of here. Called my father and told him to come get me. Got him extremely upset. I don't need my 89-year-old father that had worked 3 years to try to restore a relationship destroyed by my former wife, who's dead now, Cindy Stigall. And anyway, he'd taken me to some doctor appointments, and he was being decent. He brought some clothes I ordered from Amazon because it took 4 days longer to get him to this facility than to his house or my house. And he had said he was going to come see me. So he brought my clothes on Monday, and ironically that OT session, occupational therapy, which is not the correct term for what they're doing here for occupational therapy. It's more personal needs and taking care of oneself, and physical therapy is strengthening mobility, etc. Anyway, my OT person, I believe her name was Kendall, worked with me on getting my clothes on, which was the first time I'd had clothes on since October 21st when I was admitted to Atrium Health Pineville Hospital, and had major surgery on my back on 11/4. They had to fuse 3 vertebrae and they did a laminectomy, which as far as I know is basically taking bone off the part of the back to make space, but they had to make space for the spinal nerves because I'd had that bacterial infection back in 2021 that my family denied and called a mental problem when it was diagnosed by multiple doctors, and Dr. Weinrib at infectious disease doctor at Atrium CMC, Maine, as they call it, the main hospital for Atrium in Charlotte, which is uptown off of Kenilworth Boulevard. Anyway, he told me what I had was a 1 in very large number case, and when I asked him if it was a time period, he said that it was ever. So anyway, I've been through a bacterial infection where they couldn't identify the bacteria, maybe because they had already been giving me ceftriaxone and vancomycin, very strong, broad spectrum antibiotics, and expensive from what I'm told. At least they were expensive for me. Anyway, I was told on April 21st of 2021 I might never walk again unaided. They told me what I had, and even though I had my computer and my phone, I didn't want to look it up. So they told me that I had 3 to 12 months of treatment ahead of me, and that I had 2 to 3 years before I could have surgery. I made it to 3 years, and I was doing well, and then all of a sudden in April of this year, my legs just went numb. And I went back to the surgeon who I'd seen earlier in the year, and he had told me surgery wasn't possible because the bones were so damaged that they wouldn't hold screws or any other kinds of anchors. Well, I go back to him in June or July, and he wanted more MRIs, and this time he came back and said that surgery was the thing that could be done to give some room to the nerves that had been pinched, that there may be so damaged that restoration might not be possible, but he thought he could at least stop the pain, which was requiring a minimum of 4 10-milligram oxycodones a day just for me to survive. So I get to Atrium Hospital, and I arrived at the ER, and they admitted me. Nothing was getting done, and I was being told that I needed to go to a rehab facility, that I was medically didn't need to be there. However, my gastroenterologist and the surgeon both wanted me to have an EGD because I had a torn esophagus in 2023 and had not been able to get the EGD and colonoscopy done. Anyway, Dr. Nami on Tuesday, before the 4th, whatever the date is, called in Carolina Digestive, who had treated me, and that's practice Dr. Stevenson, my new GI doctor as of January, who started giving me prednisone again, is with, and I think his name's Dr. Depeche. I could be wrong. Anyway, I haven't looked it up. So anyway, Dr. Depeche comes in that afternoon and tells me that they want to do an EGD. They did the EGD on the following Wednesday and found out I had gastroparesis and had to abort it because they couldn't really go into the duodenum or whatever it is they need to do. But nonetheless, the gastroparesis wasn't clear to me if it's a permanent condition, or I believe they thought it might be due to the opioids and the pain meds I was getting. So after that, they wanted to do a barium swallow. I did a barium swallow and found out I have, if I say this properly, esophageal dysmotility. I had what's called Slatsky ring, where tissue forms around the ring, the band at the valve or whatever it is at the top of the stomach into the esophagus, and so they found out I have this esophageal dysmotility, and I posted about it on Facebook, and one of my friends, I think his mother had it, and they put in either electrical nodes or magnets to fix it, because what's happening is it's not moving food down, which has caused me to choke. So another thing was, on the Monday I got to ER, I happened to have a video appointment with Dr. Chow, a rheumatoid arthritis doctor, with Atrium, and I told him about my pain in my knee and the pain in my hip, because I've been suffering extreme pain in my left hip, but not in my right hip. And I told him about having had cortisone shots from Dr. Jaffe at Carolina Bone and Joint in January, and then again in February, and I missed a few months, and it started hurting right about the time my legs went to jello, and in April, and it relieved the pain in my right hip to a degree, and even into my back a little. And I told Dr. Chow that nothing was being done in terms of looking at x-rays of my hip or MRIs. The MRIs were only on my back, which I understand. That's what Dr. Ziwatz, the surgeon at Carolina Neurosurgery and Spine Associates, was looking at, and he couldn't put together why I was hurting on the left side, but I think I kind of did. I think what's happened is I actually have arthritis. We'll back up for 1 second. After I talked to Dr. Chow during the first week, they did do x-rays of my hips and knees, and those were available to the doctors doing the rounds, and one of the doctors looked at my right hip and said that there was arthritis there, but he couldn't say if there was arthritis in my left hip or not. However, Dr. Chow had suggested it would be worthwhile getting a cortisone shot into my left knee, and it might relieve the pain in my hip. And tried to do that in the hospital. Somehow a hospital wasn't able to get a cortisone shot into my knee because I told them I feared it would still be there after a surgery. And guess what? I had the surgery on 11/4, and I'm not going to get into what happened after 11/4 right just now, but the left pain has still been here. I don't know if I said it earlier. I'm at Encompass and Nursing Home, or Encompass Nursing Hospital in Fort Mill, South Carolina. They've only been open since September. A nurse at Atrium before I left said that I might want to go to the Rock Hill facility because the new facility, while it was shiny and new, had a lot of new people that were inexperienced, and she had heard of some bad experiences, and she recommended I go to Rock Hill if I was going to do the Encompass. Unfortunately, I was convinced, even though I thought I needed to be in the hospital until the 13th, I guess it was, Monday, or whatever it was. Anyway, a week from whatever the surgery was, on the 4th, actually. That would have been the 11th, Monday 11th. But anyway, they basically yanked out a drain tube. Nurses not knowing what they were doing, never had done it. Had a drain tube tied in very tightly with sutures. One of the, I guess he's one of the upper level nurses, was digging in my back with a little tool with a little hook on it. And I told him it was hurting like hell, and they wouldn't do anything. And he was digging in for the sutures, and I had no lidocaine or anything to stop the pain. Anyway, I get to Encompass, and they got me settled in for the night. And then the next morning, I get a nurse coming in, blaring at me and yelling at me, and I tried to get her to pause. And eventually, I had to tell her that I wasn't here for fucking boot camp, and she left, fortunately. And then her manager shows up, and then sometime in the next day, I don't remember, another nurse shows up, and I had a problem getting some milk. I've had extreme problems getting milk, and I'm busy. Excuse me, I can't be interrupted. I cannot be interrupted. I'm making a video about what's going on here. Okay, well, anyway, this is going to wind up in the video, okay? So, anyway, I just got interrupted, which is typical. You ask people to stop, and they won't. And I just went through a major surgery, and that's exactly the type of thing that's been going on here. The rest of this will be an encounter with a nurse on Saturday night of the 15th, actually 16th. And so that's what's coming up in the rest of this video. I got interrupted while making my video, kind of the summary video. The part that follows this should be an interaction with a nurse on the night of Saturday, November the 16th. I woke with a very acidic stomach. I've had 2 Crohn's resections. I've been drinking booze for years, and I try to do the low sugar, but the regular ones do better for me at home. And I have a subscription on Amazon even, and my dad brought some to the hospital to me when he came to see me just before surgery or sometime in that 2 weeks. Anyway, I'm adding this into the video just as a little precursor. And something happened after the tech barged in to do the sugar thing. I'm sure they heard me talking. But anyway, I'm going to let you hear how this nurse treated me, which has not been unusual here, unfortunately, with a couple of the nurses. And I've got audio of it. It's going to take me a while to get through things. But anyway, like I said, here that comes. And after this video from the 16th will be some from tonight, where the nurse is challenging me on recording her and it being legal in the state of South Carolina. So there will be response to that, and I'll probably try to pop in some of the actual South Carolina code so people can read it. I'm doing this primarily for Medicare, but if you put your loved ones in a rest home, this is what happens, especially when they can't get communication to you, and the people in the rest homes will do whatever they have to try to prevent them from tattletelling or whatever, so that they can keep their jobs. And predominantly the problem is with the minority majority on second and third shift. So anyway, I'm not being racist at all. That's just the truth.
Hey, she already told me about what you were calling about for pain, but I'm letting you know now that you're not able to get anything else for pain until about 3 something.
Really?
Yeah.
I thought it was 4 hours.
No, it is 4 hours, but you last got something around like 11 something. That was the last time you got meds.
Well, I need something to drink because I'm extremely dehydrated.
Well, you have water here in your cup.
I know, but I need something for both for my stomach. I feel like she's been under the impression that Medicare's not paying anymore. That's absolutely wrong.
Well, I don't have, honestly, Mr. Don, I can't tell you that. Only you would have to speak to the case manager.
I know, and I've got the papers right here that say it, that Medicare is paying during any reconsiderations. There's no chance Medicare's not paying. And the thing is I'm hurting and I need something to drink other than just water because I have.
Mr. Don, it is 1:30 at night right now.
I have Crohn's. I'm used to getting up and having to drink milk.
You want milk right now?
Either milk or, that's what I told her, milk or something that is not going to irritate my stomach. Like right now, soda will irritate my stomach.
Okay.
The tomato juice that they bring me with every meal will irritate my stomach
Well, I'll
and
get you some water.
make me a sad.
I mean, some milk. I'll get you some milk.
That's fine. She said, okay.
I'm just letting you know, you can't get anything else for pain right now. If I could get you something, I would. The only thing you have is Tylenol, and that's probably not going to do anything for you.
You're right. It doesn't.
Right.
Well, the Roboxin or whatever it is, they told me the practice to take the muscle relaxers or whatever, but so if I can have that, I should be able to have the muscle relaxer.
For muscle spasms?
It's called Roboxin or something like that.
Okay, well, I'll take a look at that for you, and I can bring that and bring you some milk.
Yeah, I mean, I remember getting pain medicine. I just didn't remember what time it was.
Yeah,
But
it's about 11 or something.
the thing is I'm at a solid 8 or 9, and I'm hurting. So
Well, do you want me to get you some Tylenol as well?
whatever. I mean, yeah, even Tylenol.
Okay, well, we can do the Tylenol and the muscle
Tylenol
spasms.
might take it down a little notch, so
Well,
yeah.
I'll bring that for you.
But if I take the Tylenol, I'm still gonna be able to get something after the 4 hours, right?
Yeah, but it won't be 4 hours until 3 something. It's
Okay,
only one.
and that's fine. I
Okay.
didn't know what the time was. I was asleep the last.
No, you're fine.
Well, I had been asleep, so.
Okay, I'm gonna get that for you, okay?
All right, thank you.
I thought I pushed this light off.
Yeah, and because I didn't push down in time, I had tea between the seats, which was an unnecessary mess. But anyway, I was.
You hit that button on your
Oh.
that remote. You
Which
hit that
one?
button. Hit the.
What, you need it on so you can reset or something?
I did. I thought. There you go. Did it do it?
It's 125 on the light now.
I pushed it. Oh, that's what it was. I'm looking at this. I feel like I know what time comes to it. there's no milk on the floor right now, so that's something you would have to wait to get in the morning, because we don't have access to the cafeteria. But I did get some Robaxin, which is your muscles for muscle spasms, and some Tylenol, okay?
You have, what about the Glucerna?
What do you mean about the Glucerna?
I'd ask Bree about eating Glucerna or milk.
Well, I know we don't have any milk right now on the floor. I can check and see if we have some Glucerna, but I don't know if we have that either.
Okay.
What do you want if we don't have the Glucerna? Because there's nothing we can do right now
Well,
at 1:30 in the morning.
I want something to help buffer my stomach, even if it's like sucrafate. I need.
You already had some of that tonight. That's what you drink in the cup, the
I
pink
know.
stuff.
Yeah.
Yeah, you already had that.
Well, I'm just saying it'll help my stomach. I can drink up to 50 to 60 mils a day of that.
Right.
But it helps my stomach. That's what I take at home when my stomach is like this.
Mm-hmm.
My stomach is acidic and hurting.
Okay, well, here you got some Tylenol and some Robaxin right now.
I need something, Tums or something to help acid in my stomach.
Can you see still?
Excuse me?
Can you see still? Hold on.
I don't need those. Turn this on. Thank you.
What you got here?
For V8s?
Yeah.
For V8s, I come with every meal now.
Okay. You should be asleep.
Huh?
You should be asleep.
I wasn't asleep. I slept all day yesterday.
Okay.
I slept most of the evening. I'm well rested, but the thing is, like I said, my stomach is burning. I've got the
But
acid.
you shouldn't be drinking that. That's not going to help you.
It does. It does.
No, it doesn't.
I drink food all through 2021.
It's not booze.
I know the same thing. It's got the protein, it's got protein and other stuff in it. God damn.